The following is a special live presentation of Nurses Station.
This healthcare system of ours is badly broken. Let us guarantee every American comprehensive health benefits that can never be taken away.
Everybody, I'm Vicki Hudson, and I'd like to welcome all of you to a very special Nurses Station. We have decided to do something a little different today so that you, the nurse, can become informed as to how the healthcare reform is going to directly affect you in your clinical practice. Now, through this live interactive format, we're going to hear from nurses in all areas of the healthcare system and the questions they have most about this new healthcare reform plan. All of us here at HSTN could not be more delighted to have the two honored guests we have here today. They're going to help us in defining how the healthcare reform plan will roll out to nurses. Joining us is Virginia Trotter Betts, the president of the American Nurses Association. Mrs. Betts is currently serving a 2-year term as president of the ANA, which is the nation's leading professional organization, representing 2.2 million registered nurses. Mrs. Betts is a nurse attorney on sabbatical from her position as a senior research fellow at the Vanderbilt Institute for Public Policy Studies while she serves as ANA president. She is also the president and CEO of Health Futures. In her 20 years as a professional nurse, Mrs. Betts has worked as a staff nurse, a clinical specialist in psychiatric mental health nursing, an administrator, a researcher, a policy analyst, a nurse attorney, a consultant, and an entrepreneur. Also joining us is Gwen Johnson, nurse coordinator for the Howard University Hospital in Washington, D.C. She's now serving her second 4-year term as a staff nurse member of the ANA Board of Directors. Mrs. Johnson serves on the ANA Political Action Committee Board of Trustees. Mrs. Johnson was the president of the District of Columbia Nurses Association and sat on the DNCA Political Action Committee Board. As a delegate to the ANA House of Delegates and a member of the advisory board of the ANA Center for Ethics and Human Rights, she's represented the ANA at the World Health Organization meeting. We welcome and thank you both for being here with us today to discuss these very timely and important issues.
Thank you, Vicki. I'm very pleased to be here today to talk with you about President Clinton's health care reform plan, the American Health Security Act. The President and Mrs. Clinton actively sought the advice of individual nurses and nursing organizations throughout the entire development of the health care plan. The American Nurses Association had more than 25 meetings with the White House this past year, and we met with Ira Magaziner, the chief architect of the Clinton plan, on 3 separate occasions during the final week before the plan was unveiled. During that very hectic period, the White House made time to meet with nurses and to hear what nurses thought when so many other groups were turned away. The President mentioned nurses 7 times in his health care reform speech before Congress and the nation. And clearly, the President values and supports nurses very much. After all, you know his mom's a nurse. And that is very evident in the exciting and new opportunities that he's created for nursing in his plan. He has heard us, and he has acted upon nursing's requests. In 1990, 70 nursing organizations developed and endorsed a plan to restructure the healthcare system in America, and it is called, as I'm sure you know, Nursing's Agenda for Healthcare Reform. President Clinton and Mrs. Clinton read Nursing's agenda and incorporated it into their own. And I'd like to share with you some of the items that nursing requested and that we know that we are going to have if this country is able to pass the President's plan. First, nursing has requested that all Americans have access to health care, and we got that. Nurses wanted health care to be delivered in convenient community locations. It's in that plan. Nurses asked that more primary care services be included in the basic benefits package. We got it. Nurses wanted professional nursing services to be recognized as a separate component of hospital services, distinct in its own right, and we got that. Nurses wanted advanced practice nurses to be fully recognized as qualified health providers right alongside physicians in the American Health Security Act and in the Medicare Act. We got that too. Nurses want a federal preemption to override inappropriate barriers to nursing practice in the individual states. We got that. Nurses wanted more federal monies for nursing education, plus a larger share of the money that goes to graduate medical education. The President gave us that in his plan. As consumers of health care, nurses wanted to eliminate pre-existing conditions that insurers had erected against individuals trying to get out higher risk individuals from coverage. And we wanted a limit on a person's out-of-pocket expenses following a catastrophic health event. And we got that. Nurses really want more recruitment of ethnic and minority nurses to reflect the cultures in America today, and we got that. For these and for so many other numerous reasons that I would like to talk with you about throughout this program, nurses and the American Nurses Association is supporting President Clinton's plan for health reform. But I will tell you, the battle is just beginning, and we need your help. Each one of you is very powerful because of your individual expertise in health care. But we as nurses as a whole are very powerful because we are the largest block of workers in American health care. There are 2.2 million registered nurses, and 1 out of 40 voted registered women who are registered to vote is a nurse. Think about the power if we get together. Nurses are held in great esteem by the American public. We need to come together. We need to talk to our consumers. We need to talk to our congressional leaders, both in the Senate and in the House. We need to talk to our governors and our state representatives, and we need to say to them clearly what nursing has been saying since 1990. The country needs health reform, and we want to have the provisions that President Clinton has put in the American Health Security Act, put in all plans, so that when health care reform is passed for the American public, nursing's provisions are there, and we nurses will have even a larger role in the reformed health care system. I'd like to introduce to you now Gwen Johnson. Gwen is a staff nurse in a large urban hospital in Washington, D.C. She's a member of the ANA Board of Directors, and she's both my good colleague and my friend. Gwen, thanks for coming.
Thank you, Jenna. As you mentioned, I'm employed as a staff nurse, and I know that many of you have questions about how healthcare reform will affect your jobs. I share your concerns, and I'm here to try to answer some of those questions. We know that staff nurses are concerned about overall, first and foremost, the quality of care that our patients receive. But just like anyone else who's a worker, you're also concerned about job security, loss of well-paid nursing positions, job freezes and staff cuts, layoffs, and mergers, acquisitions, and closures of hospitals. First, let me assure you that the American Nurses Association shares your concerns and has discussed them with Hillary Clinton, our magaziner, and others at the White House. We've also talked with the Department of Labor, the Department of Health and Human Services, and the Department of Labor has told us personally and has gone on record publicly that the net loss of total jobs in the healthcare system will be small. However, there will likely be some layoffs of hospital workers, and included in those workers will be nurses as the plan is implemented. ANA has been monitoring this situation for the past year, and we are dismayed and alarmed at the growing number of inappropriate and hasty layoffs, especially in acute care hospitals. Earlier this year, we issued a very public press release on nurse layoffs that was widely covered by the news media. Just last week, we did a story with CBS Evening News about layoffs of nurses in hospitals. We have been assured by the Departments of Labor and Health and Human Services that they are closely watching this situation, and especially as it affects the quality of patient care. Again, something that is most important to us as nurses. Overall, we believe the number of layoffs will be small and short-term, but let's not fool ourselves. Some will occur nonetheless. A large number of nurses will continue to work in hospitals where the patients will be more acutely ill and will require even more intensive nursing services. Let's talk about this in both the short and the long term. As I mentioned, in the short term, the Department of Labor believes that the ANA and others who have talked with them agree with them that there may be some relocation of jobs as resources shift away from hospitals and physicians' offices to outpatient and managed care settings. ANA has worked with the Department of Labor and the Department of Health and Human Services to implement a transition plan. This plan would both protect the quality of patient care and provide for retraining and reemployment of personnel. ANA wants that transition plan to contain retraining programs to prepare nurses like you and I to move into positions in primary health care, public health care, and critical care across a variety of settings. We want conversion boards to help hospitals at risk of closing to move into other uses in the community, such as nursing facilities. We want you and affected other hospital employees to know ahead of time about hospital closures or mergers, just so that you can plan for change and so that you can ensure that you have your health and pension benefits continued until you move into a new job. Now let's look at this in the long term. Healthcare reform will provide enormous opportunities for nurses, both in hospitals and in brand new settings. Included are the community, ambulatory clinics, managed care systems, public health, long-term care, home-based care, and advanced practice nursing. Experts are predicting an additional 750,000 jobs in a reformed healthcare system, and many of those jobs will go to us, to nurses. We are working to assure that nurses have career security across their working lives, not just job security, and that's going to be very important to us now and in the future. In a reformed healthcare system, nurses can expect many positive changes. Some of those changes will include the fact that nurses will have a more important role in the new healthcare system. That's been made very clear by the President from the beginning. Nurses will receive more respect as professionals. The demand for nurses will increase in order to meet the needs of 37 million uninsured Americans. That's a challenge I think we're up to. There will be new job opportunities for nurses in brand new work settings. There will be a removal of barriers to nursing practice. There will be a lot more federal funding for nursing education. There will be a greater role for nurses in the healthcare system as primary care providers, case managers, and administrators, as well as policymakers. There is going to be some pain in the short term, and we recognize that. But in the long term, nurses will fare better than almost any other category of healthcare worker, and I think we deserve it. Thank you.
A lot of good information there, Virginia and Gwen. That was a tremendous amount of very good information. And we'd now like to turn to both our studio audience and our viewing audience and give them the opportunity to ask you some very direct questions about some of the individual concerns they're thinking about at this very moment. Now, for members of our viewing audience that would like to participate in asking either of our guests a question, you can call us here at AHSTN. Our number is 1-800-533-2786. And now let's turn to our studio audience for some questions. And if you could please state your name, your position, your title, and healthcare institution before you ask your question. Okay, who'd like to ask the first question? Do you have a question for him? There's one. All right.
My name is Karen Husenfeld. I'm on faculty at the University of Texas in Arlington, and I guess I have a question in relation to, we have prepared nurse practitioners and people in advanced nursing practice, and what we're finding right now that there are barriers to their practicing to the extent of their knowledge and skills. And I'm wondering if you think this reform package would help in that, and in what way, and how. My second part of that, if I might, is in relation to how then we need to continue to prepare these advanced nurse practitioners so that they're able to focus and work within these community agencies.
Who'd like to address that question?
I will certainly try that. It is, I think, very clear that the American Health Security Act, as it is currently envisioned, will certainly decrease the barriers to advanced practice nursing. That was one of the things that ANA worked that last week to get from the White House, and we were successful in getting. And it will be done in that it clearly says in the Health Security Act that no state may erect inappropriate barriers to the authorized practice of professions that they must use a national standard in certification. Certification is going to be very important for all of us nurses, and that no longer can a plan refuse to take whole categories of professionals. So I think it's a huge step forward that nursing has been working on. As you know, the state nurses associations have had to work on the barriers to nursing practice on a state-by-state level. This will be one step forward in terms of getting those barriers dropped fairly immediately, so that 37 million people and about who are uninsured and 60 million people who are underinsured can have care. And about preparation, I think it is very important that we continue. In fact, in this bill, there is a great enhancement for nursing education at the baccalaureate and above. There is a 20% set aside for nurses for the National Health Service Corps and 10% of the GME for advanced practice nursing. Now, what should the content be? First of all, I think it is very important that we quit educating nurses in clinical in hospitals. Care is going to be in the community, and we in nursing education are going to be challenged to find community sites for nurses to practice in when they're in school. We are going to have to give them more individual responsibility in school. I certainly believe that programs we're going to have to teach better health policy, health politics, legal issues, ethical issues, and economic issues. Nurses are an economic force in health care, but the individual nurse needs to be more economical in her individual practice. And so I think there's a lot of change ahead for nursing education, and as a nurse educator for many years, I welcome that change.
Gwen, do you have anything that you'd like to add?
I'd just like to add that one of the advantages that we have as a profession is the fact that there are so many nurses waiting in the wings, ready, willing, and able to go into those programs that you're talking about. And I think now that we know that those monies are going to be available to them to assist them in attaining that educational goal, that we're going to see a rapid influx of a lot more nurses interested in your programs and interested in becoming primary care providers.
Now, you talked about baccalaureate nurses. What about ADN nurses?
Well, the ADN programs, Vicki, have historically prepared nurses to work in hospital settings, because hospitals are going to be downsizing, merging, and or trying to get their patients out of the hospital sooner. I think that the associate degree community are really going to be challenged to see what their future role will be in nursing education. I certainly hope that there will be a whole lot more articulation between associate degree programs and baccalaureate and or master's programs. And I think that that's really something that the nurse educators of the country are going to have to come to grips with, and we're going to have to do what's best for patients, the healthcare system, and for nursing. And so I think that we're going to see a different mix of new graduates in a very short period of time because of where the money is going to be for nursing education.
There's a lot of information to digest here, but I know we're not answering all the questions yet. So again, to our viewing audience, if you'd like to call in with a question, our number is up on the screen. Is it up on the screen yet? We're working on having it up on the screen. If you'd like to address a question directly to Virginia Trotter Betts or Gwen Johnson concerning how the health care reform plan is going to affect nurses, do call in. The number is now on your screen, 1-800-533-2786. And now again, let's return to our studio audience. Who has our next question? Yes.
There's a lot of talk. I'm Deborah Anti-Otong, and I am a psychiatric clinical nurse specialist at the Department of Veterans Affairs in Dallas. And there's a lot of discussion about educating new folks, but what about those nurses who are working at the bedside? They're going to be displaced because of all the changes. What is ANA, what's ANA's plan as far as assisting those folks in the transition?
That's a good question.
I'd like to start with that one, if I may. One of the things that became very, very clear to ANA very early in this whole process is that there needed to be a transition plan. How do we get from point A to point B with as little crisis as possible? Because certainly we're concerned about the quality of care, and we're concerned about retraining opportunities for those same nurses that you're talking about. So that's been one of the big focus of our discussion points with the Clinton administration and with the Department of Labor. And so they recognize the importance of a real orderly transition plan that will allow for retraining opportunities, and a lot of the monies will be focused at helping those nurses to retrain from those inpatient acute care settings and move into those outpatient settings that are going to be so critical under the reformed health care system. And I think that's an important piece for nurses to understand. There are going to be those opportunities there through continuing education. There will be increased access to RN BSN programs, because we certainly recognize that education continues even beyond the point that you get that RN license, and that we've got to do something to ensure that nurses have those opportunities available to them.
I would like to say, though, if I could, that while we were very successful working with the White House on the redeployment monies, the transitioning of nurses in the current setting to the settings of the future, what I think that we're going to experience is that before this plan is passed, because the way Congress is going, I don't think we're likely to get the thing passed before '94, and even if we're able to, as nurses, to lobby successfully to keep the redeployment monies there, between now and when it's passed, I think there are going to be a lot of downsized problems for nursing, because I don't think that I think we have many employers and hospital administrators who don't realize that their best buy in healthcare is the expert nurses that they currently have working for them, and the very smartest thing they could do would be to take those nurses, get their ideas about how the institution can survive, and to help the nurses move from an inpatient setting to the community. Psych is a perfect example. I mean, I think that we all need to remember the history of nursing. Nursing started in the community, and we allowed ourselves to become, and we were individual, we got our reimbursement directly from our patients. Then we allowed ourselves to move into a hospital and become employees. I think this is going to be a transition back to our roots, so to speak, and we are going to have to help our employers understand we're their best buy, and this inappropriate layoffs that are going on around the country, we need to tell our consumers, you know, it is not safe to go into a hospital that does not have nurses. And I think we need to all be committed to saying that together. And the ANA is going to say it loud and clear in Washington, and I know we're in Texas today, and I know that the Texas Nurses Association is saying that very loudly here in Texas.
Virginia, let me ask you, what is the ANA's relationship like with AMA?
Well, I think that on many issues about health care, we are in agreement. We have had several things that we've worked on recently. Issues about violence, domestic violence, we've worked on programs with them about that. We have been very interested in, as we went along toward health reform, working with them on universal access. We have a lot of things in common, but if you have read the paper lately or watched TV, Vicki, I'm sure that you've known that they have taken a very adversarial position to the ANA on several pieces, most importantly of which to us is that they've really taken this position that nurses are not appropriate primary health care providers, even though we have done it beautifully for over 25 years, and have begun to raise an issue with the consuming public that maybe the quality of nursing care is in question, and really doctors should remain in charge of the healthcare system. I say to that, it's a turf issue for them. It's an economic issue. Doctors want to be the captain of the ship and the coach of the team, and it's really not very cost effective for consumers, for the AMA to take that position, and we simply have been trying to respond to that. I wish we could be more collegial with the AMA, and I would hope that they could see our really good relationships with the American College of Physicians, the American Academy of Pediatrics. We work very well with them because for us, the consumer is the real interest, not the pocketbook. But I don't believe that that has been the position of organized medicine.
Do you see that relationship improving anytime soon, or is it a lost cause?
I would hope so. I think, don't they have new elections coming up soon?
Now, you all have been listening very intently. Do you have another question?
My question ties in with, I'm Fran Scholl, home care nurse with Baylor University Medical Center, and legal consultant and expert witness, and also am an advanced nurse practitioner. My question ties in, I'd like to make a comment followed by a question relating to both health economics and public education. One of the things that I believe strongly is that you do not save money by cutting corners, and I think that the some of the healthcare groups in our country have duped the American people into believing that when we have a system with non-physician providers that we're going to be losing quality, which we were just talking about. And the truth, I think, is so evident. If you look at economics, the most cost-effective care is one in which you have the healthiest people as soon as possible. We've said we have high technologies that we're going to preserve, that we're going to use preventive measures and primary care to affect this. But I think the American public does not have the message. They've not received the message yet that the most cost-effective, the least expensive health care is in fact the very best. Because anytime you sacrifice health, it costs more money. And I just don't feel that message coming across strongly. I did not hear it in Clinton's presentation. I do not hear it. It's kind of a half apologetic, oh yeah, it'll be the same or better. But people say, yeah, sure. They just don't believe that, because I don't think we've made that point strongly enough that in economics, the best costs the least.
Well, I think it is because, if I might say, it is because our nation has operated under a medical model of care for so many decades that the American public, although I do want to refute that, I'll come back to that in a minute, many people in the American public, and certainly the AMA, for example, when they talk about the best health care and does this compromise quality, is the most high-tech care. We all know, everybody in watching this program probably realizes that the best place to get primary health care and to be treated for the flu or to get an immunization is not the hospital emergency room. It's the most expensive, but it doesn't make it the best. What is the best is care that you receive from birth through death, where the provider knows you, that there's continuity and someone is taking the responsibility of putting your health together, and you focus on health and not illness. The whole system is out of whack, and it's broken because this system pays for illness care. Let me give you an example. It costs about $55 to be immunized against hepatitis B, an immunization that's now being recommended for children and adolescents. The very best insurance policies do not pay for that immunization, but the very best insurance policies pay for $10,000 worth of treatment after you have hepatitis B and perhaps have chronic liver damage. Now that doesn't make sense, and the American public, I believe, understands that. And one of the things I think that we as nurses have a responsibility to do is to talk to our consumers, because the nursing profession is so well respected. We are second only to the clergy in the respect and value and integrity that the public sees in nursing, whereas I think it's like 70% approval rating by the public, where medicine is 12%. And so I think that we cannot continue to allow all the public relations to say, if you want to know about health reform, ask your doctor. No, if you want to know about health reform, ask your nurse, and there are more of us to ask, and we will tell the real message. I think nurses are in the business of delivering health care because of consumer need, not because of nursing greed. And I think that the public knows that, and we've got to get out the message.
I'm glad you asked that question. That was good. Thank you. And I think a lot of other people would agree with that particular position. Lots of questions, I know, but I think you also probably have some comments that you'd like to make. Anybody? Well, let me take this time to remind you once again, if you are in our viewing audience and if you'd like to address a question directly to Virginia Betts or Gwen Johnson concerning how the health care reform plan is going to affect you, give us a call, and this is the time. Our number is 1-800-533-2786. And now let's go back to our floor. By the way, how are you finding nurses are responding? Are they... everybody's got a particular opinion, but is it the same opinion? Do nurses tend to have one thought about all this?
Well, I think that the nursing community, the organized nursing community, as we said earlier, 70 nursing organizations, specialty groups, and generic groups have supported nursing's agenda for health reform, Vicki. And I think that for any group to put forward an agenda to talk about health reform for 3 years and then to have a president and his administration come forward with a plan that is very similar is an exciting time for all of the nation's nurses. I think that you've feel a lot of excitement. I think that our greatest concern is this do-nothing Congress that is so combative, that is having such a difficult time being bipartisan, really coming out with a plan that's coherent. Public policy in this country has been done incrementally for so long. I think it's very hard for our Congress to come together and pass a package that's comprehensive without every little special interest adding something or taking something away. And I think that the nursing community's got to come together and make sure that the elements that we found so important when we wrote Nursing's agenda stay in that plan, become a part of the Republican plan, become a part of the compromise plan, so that the American public really gets a package.
Gwen, you look like you're just busting to say
Well,
something.
I was just thinking that from the perspective of a nurse, we're both the consumer and the provider of nursing services. So we can look at it from two aspects and be very happy with the President's plan and what it's saying. As a consumer of services, one of the things that has made it very difficult for a lot of nurses in the past in terms of wanting to go on to other positions or anything is the fear that they might not be able to carry their health benefits or other kinds of benefits with them, primarily the health care benefits though, because of things like pre-existing conditions and other possible barriers to them being able to get the care that they wanted to get in a new job setting. One of the things that the President talks about is the security of being able to take your health plan with you and not being encumbered by pre-existing conditions in terms of qualifying for another health care plan. So from a consumer perspective, that makes a difference to us as nurses when we're trying to branch out, to be entrepreneurs, to do things, to go to school, all those things that are important to us. But in addition to that, as providers of care, we are really of one voice, and one of the big reasons is because we now see that the encumbrances, the inappropriate barriers to practice that Jenna talked about that will now be lifted under the American Health Security Act are very important to us in organized nursing, and it has brought us together in a way that I think is unparalleled with any kind of healthcare provider group.
I think you're probably right. Talk to us about the lobbying efforts of the ANA.
Well, they've been extensive.
This could take a while.
This could take a while.
Just jump
the American Nurses Association has a PAC. Gwen is on the Board of Trustees. We were very involved in the 1992 elections trying to support and be out there very upfront for candidates who were for health reform, both in the Senate and in the House and in our local areas. And we did support very publicly and endorsed the Clinton-Gore ticket. We then, from the moment they got elected, began to talk with the healthcare transition team about why we had been involved in the elections. And we weren't involved in the elections to be in politics. We were involved in the elections because we wanted healthcare reform to be a front burner issue. Well, guess what? It is. And so then we have been very focused with them on content pieces. Many nurses are health policy experts. We give care 7 days a week, 24 hours a day, and we know what works for patients and what does not. And we have been sharing that with them over 25 times since they took office in January. And I think we have made tremendous strides in shaping this healthcare reform plan to look the way nurses want it to look. But now our work is just starting all over. Now it's going to go over to Congress. We've got to start with 535 legislators on the very same issues. We have got to work with governors because some states are going forward with state reform at the same time. So this nursing community has its work cut out for it. And so if anybody out there is not a member of your state nurses association, this is the time to join, because we need your dues money and we need your energy and your thoughts, because we cannot do this alone. And I know that the state nurses associations would really appreciate this at this moment in time, hearing from you and having you join.
That's right. There's power in numbers, and this surely is a powerful group. We do have a call now from, I believe, Claire Lear from Lodi Memorial in California. Hi, Claire. Thanks for calling. What's your question?
Yes, we talked recently about the BSN nurse and the collaboration between the ADN and the BSN programs. Do you feel that the BSN nurse is going to be the entry level of the RNs? And what is going to happen with our ADN nurses at this time?
Well, I don't think that I was saying anything about entry. I was saying that when you look at the money that is in the American Health Security Act, the money is for baccalaureate and above education, both for generic students and for transitioning registered nurses who want to receive a higher degree. And I think that that is simply a quality control mechanism for federal monies. And I also think that because so much care is going to be delivered in the community, and historically the associate degree programs have had the mission of preparing nurses to work in hospitals, that in fact that is something that is going to have to change, and we are in nursing going to have to collaborate. I think that we have in this audience a bunch of nurse educators, and hopefully this will cause some dialogue with them. I certainly think we're going to have wise use of nursing education resources, and I expect that the federal mandate will be for baccalaureate and above.
That's a good question. Thank you. We have another question over here. I feel like Donahue.
I'm Sharon Judkins, faculty at UT Arlington. Mine is more of a comment than a question. I have watched a great deal of the nurses and the sort of the suffering that they're going through and the transitions that are taking place and are going to take place. And I'm a strong advocate of nurses taking care of nurses. And I don't necessarily see that happening. Sometimes we get in survival mode, and that isn't comfortable. What I would like to see, and challenge the nursing profession in the audience that are listening, is that as we go through these paradigm shifting, and that's exactly what we're talking about, changing our thinking from hospital to community, that we recognize we're going to go through the grief process. That is a loss. That is a loss to our identity and who we are and what we were educated from, as you pointed out earlier, in hospitals. And so as we shift to other ways of delivering that care, that we really take care of ourselves, and that we have permission, I suppose, to go through that grief process and work through it and go into acceptance, even no matter how long it takes, but that we be kind to each other and do that and help assist each other in doing that.
Right. I think at a time, I couldn't agree with you more, at a time of great stress, this can be a risk for us, or it can be a great opportunity. And if we stand together and support each other, it will be a time of great opportunity in nursing. But if, as people are stressed, they take it out of on each other, which unfortunately has happened in the past in nursing, I think that then we will not get as far along as we think we would like to. But I will say that rather than saying that our history's been in the hospital, I do believe our history was in the community, and we allowed ourselves to go to the hospital, and I think it's a reclaiming of our history. The paradigm shift we're talking about here is health and not illness, a community and not a hospital, a system and not an episode. And I think we in nursing all know that those are good, and we're just going to have to help. What I would hope is that every nurse who's at a hospital today, and I know we're downlinked to many, many hospitals, is that you use your expertise to help your hospital survive. It may not be able to survive in its current mode. It may really need to open community clinics. It may need to transition to an active rehab center and not a hospital. And so I think that we have the expertise much better than many hospital administrators, and certainly better than physicians, because we're the ones who make the system, whatever it is, work. So why not set up the system? And I urge us to do that.
Thank you. I believe we have another caller on line one, Deborah Borowski from, I believe, the Northern Hospital of Surrey County in North Carolina. Are you there, Deborah?
Yes.
Hi. Thank you for calling, and what's your question, please?
I'd like to address my question to either one who feels that they would like to respond to it. Support for recruitment of ethnic and minority nurses was mentioned as being something that will be addressed in the President's health care reform plan. And I'm wondering what your thoughts are about the methods to be used in accomplishing this recruitment across the country.
I think one of the important pieces that needs to go along with that is the fact that there's a strong focus on the care moving into the community, and the fact that the President talks about the faces of nursing reflecting the needs of the communities that they serve. And I think that's why it's such an important piece for us that there is increased funding for the training of ethnic minority nurses, because that means that the care in the community is probably going to have a greater deal of relevance to the people who will be receiving that care. I think it's important to note that traditionally nursing has been very supportive of the fact that we have to reflect the face of the communities that we serve. I think it's a positive piece that everyone else now recognizes what we've known all along, and that they're putting monies and effort and talk into making sure that that actually takes place.
Yeah, if I could add to that, in the President's bill, it does have monies to recruit and attract community workers who are of ethnic origin that would go back and care for the community. And it gives a goal, and nursing is much further along on that goal than any of the other health professions, but we certainly are not where we should be. In fact, the American Nurses Association has had historically a council on cultural diversity. We are thinking of beginning a center inside the ANA structure, a center for cultural diversity to both attract and retain minorities in nursing. We have a wonderful ethnic minority fellowship program within the ANA where we have provided funds for minority nurses to get doctorates and to go either and provide care or to be role model educators. We have done a lot, but we haven't done enough. But boy, have we done a lot more than other health professions have done, trying to reflect this dramatic demographic change in our country that we're just beginning to see the tip of the iceberg.
There are a lot of nodding heads out here. This is obviously something you agree with. She's been going,
Well, actually, I'm Pat Sayers. I'm Dean of the College of Nursing at TCU in Fort Worth. Hi. There's a couple of strains that are going through here, and I would like to make a couple comments and then just ask a question if I can. My students very recently saw a news clip that was talking about the AMA opposition to President Clinton's plan. The news clip showed a physician in his office speaking to a patient, telling them very clearly that the health care plan was going to bankrupt the country and that it had to have significant modifications. My students' questions were not, of course, whether the information that was being given was correct, but that historically nurses have not taken any kind of stance in their professional behavior or in their clinics or their hospitals in trying to do any kind of propaganda. The question that they posed, and I think is very relevant because I could not agree with you more, not only are nurses consumers and providers, they are taxpayers, and some of the questions they're asking is, how much is this really going to cost us, and what can we say to the people who are opposing the plan only on financial conditions? My question is, we know in this room probably how much healthcare system costs have escalated under the present plan that we have in the last decade. Has anyone done a projection on what it's going to cost if we don't do anything in the decade? And can we get that out to our nurses to help them at least provide information if they don't start propagandizing?
Well, I'd like to hear the answer to that. Thank you.
I think that it's great that you asked the question in exactly that way, because that's exactly what we're doing right now at the ANA, and it'll be coming out to the SNAs. There are very good cost projections on if we do not one thing different, if we do not bring one new person into the healthcare system, if we do not do anything for the dramatic changing demographics of the elderly in needs for long-term care, how much it's going to cost this country in a very short period of time. It is going to be astronomical. And so, and it is interesting that the clip they saw with AMA opposition said that the physician was worried about the costs, when in fact one of the things the AMA is vocally opposing is global budgets, because they don't think there should be any set percent on what America pays for health care. So the clip and what the physician said doesn't really go with the AMA's bargaining position. They're not worried about I don't believe the eventual cost of this. I think that it is true that nursing has not had necessarily a sense that this is my patient and I'm going to talk to them about a social issue. And I think that maybe physicians didn't used to, but now they do. And so I think that we have to decide, well, how are we going to combat this? I think the state nurses associations have thought it would probably be more comfortable for us to begin to use what all voters are using now, talk radio, call-in shows, town meetings, editorials, and having nurses and consumer groups call town meetings to really get out the real word. But we will be doing some very nice leave-behinds, handouts about if we do nothing, what is it going to cost us? And we will do that with each plan that comes out. We really do not believe that this is an issue that people can ignore. Everyone is concerned about the health care of their family right now and in the future. And I think that we have to look at where the money has gone and where have the costs gone. And some of the groups who have benefited the most from the dramatic increase in health care costs are the groups that are fighting any reform because they're doing well. Why should they want it?
And I'd like to take it a little bit farther down in talking about those of us who are nurses who are working directly with patients at the bedside. I think one of the things that we tend to forget a lot of times is that 90% of a patient's contact is with a nurse. It provides you with innumerable opportunities to talk with that patient, as Jenna said, not just about the health care issue that's at hand for that particular patient, but about the social factors that impact on the health care system and where we need to make changes. I am finding now, with all of the information that's coming across TV sets, that when I walk into a patient's room, they ask me, what do I think about this? And I spare no points in talking to them about the importance of nurses in a reformed healthcare system. I think we also have the advantage in that when you start to look at the things that will save the money and make the difference in terms of preventive care, this is first nature to us. This is what we've always talked about as nurses with our patients, and that brings it home for them and for us. So when you talk about propaganda, for us it's not propaganda, it's the way we've always done things as nursing. So it makes it easy for us because it's normal, it's natural for us when we're talking to clients, and they respect that and they listen to what we're saying.
Traveling around on behalf of the ANA, I'm on a lot of planes. You know, that's really kind of close quarters. And at the minute anyone next to me or anywhere in my area finds out that I'm a nurse, they have questions now about health reform, and I try to answer them. And I answer them, of course, in the context of what their concern is. And so that's one of the reasons that I think all the nurses should really get involved in organized nursing in their state nurses association right now, so you can be better informed to answer those questions, not to go on what the newspaper says, not to go on rumor, because we all know what some of the rumors might be, but to go on the accurate information. What does the president's plan say? What does nursing's plan say? What does the Republican leadership bill say? What is really going on? We need to do analysis, and then we need to do action.
Boy, I just want to take notes. I want to be sure and sit on a plane next to you next time. I will get to your question in just a second. We do have a phone call online. This is Janet Vanstone from Medical Center East, Birmingham, Alabama. Hi, Janet. What's your question, please?
Hi, I'm site coordinator here. We appreciate the opportunity to give you some questions. We have a group of about 20 nurse managers who are anxiously awaiting some your answers to the couple of questions they had. The first one, you mentioned that a component of the plan was to move health care more into the community. Many of the patients that are seen seeking primary health care in the emergency department are people who work in jobs making too much to be covered by Medicaid, and their companies do not provide insurance. They cannot afford to take 6 to 8 hours off to work from work to sit in a public health clinic waiting to be seen. Is there any consideration being given to health clinics being opened after the traditional 8 to 4:30 or 9 to 4:30 hours during the day? And either one of the participants can address that question. And I have a couple of more.
The American Health Security Act would deal with that problem in two different ways. First of all, there would no longer be a worker who would be working without coverage and would have access to a variety of services that would be available in what I would want to call, people are calling it an HMO, but I don't think that's the idea. I think it's more an organized delivery system. Organized delivery systems that are going to be effective are going to have many off-site places. They will never again give primary care in hospital emergency rooms because they will soon catch on that that's the most expensive place. Therefore, there will be probably a lot more occupational health care sites. There is a lot of thought to have a school, have a primary health care site that could be used by both the kids and their entire family. I think that we're going to see a lot of very convenient sites for primary care, for preventative care, for immunizations, and for subacute illnesses that really can be dealt with and can be resolved without ever having to put your foot in a hospital. So I think it's going to be not only a much more convenient thing for all of us, but we're going to be able to be in a system that I think technology is going to track our care. We are going to be on a computer, and so if we show up at our child's clinic that's a part of the organized delivery system, my record will then be available over time through electronic means. And I really think that it's really going to be exciting. And who knows better about that, Janet, than us nurses? We have tried to make the system work for everybody, even though it was fatally flawed. And now we're going to have a chance to really be involved in something that's going to try to look like a system. And so I think we're really going to be key in that.
Janet, you had one more question?
More questions. One, in the future primary health care settings, do you anticipate that nurses will be independent, or will they continue to be dependent and controlled by physicians' backup, i.e. the nurse practitioners or advanced education?
Well, it is my sense that the country cannot waste the resource of an advanced practice educated nurse who is any longer kept from practicing a full scope by national standards and certification. And I hope that what we really are going to see in the future are collaborative relationships between physicians and nurses, and no longer this dependence-independence argument. I don't think that we can waste that kind of money, and I don't think we can waste that kind of education. And I don't believe that this government plans to do that, because they really want the advanced practice nurses to be increased. There's going to be enough money in this plan to increase the slots for advanced practice nurses 2 times what we currently have. And I'm sure the deans in the audience are glad to hear that.
Your question.
I am Barbara Johnson, nursing faculty at the University of Texas, Arlington, and I think that we all know that many of our nation's health problems are related to or due to mental illness, other mental health problems, and or addictions. And I'm hoping that the current system which we have, which pretty much provides inappropriate, inadequate, or no services for people with mental illness and addictions, will somehow be bettered in this new reformed plan. And I'd like you to say something both about those kinds of services for psychiatric services and addiction services, and even if we could go a little earlier in the process, something about mental health promotion.
Well, I guess the news is mixed, Barbara, on this plan and what I guess you and I would have agreed and what nursing agreed we wanted. We really had hoped to see a greater parity in mental health services and physiological services or medical services, so to speak. There is a major improvement in this plan in terms of mental health care for both addictions and mental illnesses, but it is not on a parity with the medical or physiological pieces until the year 2001. And I'll tell you from what I know about what happened is there were just major actuaries working with the people and the scorers, so to speak, in the federal government who refused to believe the studies that says if you put money into mental health care, it will save money in physiological care, although you and I, both of who are psychiatric nurses, know that that's true. However, I understand that there is a new movement afoot in Washington to get the studies re-reviewed and reconsidered, and I would hope, and you know that especially Tipper Gore, the Vice President's wife, pushed very hard for that mental health benefits would be included just as physiological benefits. But at least there is a step forward in terms of there is the same, even though that maybe visits would be limited to 60 to 90 inpatient days a year and 30 to 60 outpatient days a year, for most people who have very little coverage in their current health policies for mental health, that's an improvement. But it is certainly something the ANA is continuing to work on. We have said to them, that's not sufficient for us because we don't believe that that reflects good data, good research, and certainly doesn't reflect the best health care.
Could I just add to that, Vicki, also, one of the things that I think will also be an opportunity and a challenge for us as nurses, we are talking now about 37 million that are uninsured who are now going to have access to health care services. Think of the challenges and the opportunities to identify problems early on that could then be referred at an earlier time than when they are actually a serious illness, be it mental illness or any other kind. But I think particularly in terms of mental illness, we as nurses have always looked at psychosocial factors and everything that impacts on a patient's health. And I think we have an opportunity now, just looking at people who will now have access to services, to be able to do closer assessments and then identify problems and refer them if necessary, no matter what the level of coverage is at this point, so that earlier treatment can begin for those kinds of illnesses.
Thank you. I'm glad you added that. That's a very good point, too. Now on line 3 is Kathy Kerfoot. You're calling from Enid, Oklahoma. Kathy, you're at St. Mary's, right?
Right.
Hi. Thanks for calling.
Hi. Thank you. I'd like to ask, how do you see the role of the LPN or LVN that's in the hospitals, especially the rural hospitals now? They're taking care of the patients. And also, I work in quality management UR, and I was wondering how you saw all the nurses in the review companies. Is there going to be an influx of these nurses back into practice?
Well, I think that the role of the licensed practical nurse is going to evolve just as the role of all nurses who've spent their careers working in hospitals. I think the whole issue of the rural hospital is really enhanced with the President's package because rural hospitals who really are an essential community provider will not be able to be forced out of the system, but will have an opportunity to hook up with urban areas. In fact, you cannot be an accountable health plan and a major medical center unless you show that you are hooking up with rural hospitals providing a rural network, and I think that's a step forward for rural care. I think that the licensed practical nurse, as well as many other nurses who are experts in their field but will need to have enhanced education either to care for more elderly, more acutely ill, or care that's going to move to the community, will be like everyone else. We really are going to work hard to have a piece of the education pie to allow you to redeploy or retrain to be whatever the healthcare system in the future looks like.
Really glad you said that. You're nodding. Wanted to add one more quick thought?
Well, I was just thinking one of the other things that we also tend to not reflect on, we're kind of worried about where everyone's place is going to be in this system. We have to keep in mind that everyone's place is going to be changing, and we have to look at that change as something great, something good that's going to happen. But I think we also have to look at the fact that with everything that's going to happen, with this rapid phasing that they're talking about in terms of access to services, that there's going to be a lot of work for just about everyone who is actually involved in delivering health care to people, and that we need to focus on the fact that there's a lot of work for all of us to do, and then get into the retraining business. Get into really looking at how we can improve our skills and help make the delivery of services a lot better.
She asked a question about utilization review, which I just didn't say very much about, but one of the things that we worked very hard with the President's task force on is that nurses do not mind competing on cost and quality. But we certainly mind competing on cost only. Certainly, nurses cannot compete with unlicensed assistive personnel on cost because they certainly cost less. But you know, is it quality care to be flipping hamburgers at McDonald's one day and doing an IV tube the next? We don't think so. And so we have worked very hard on having this plan focus on outcomes research, on practice parameters, practice guidelines, and national standards. And so I think that well-trained utilization nurses who really have the skills to do outcomes research and outcomes data analysis are going to have a really tremendous role in the reformed healthcare system. But I do believe that we are all, every one of us, are going to have new knowledge and skills, and that should be exciting and not frightening.
Maybe a little of both. I don't know. We have time for one more question from the audience. Oh, there it is. All right. Oh, you're TV trained. You knew right where to go. Wonderful. Hi.
Rose Neswadomi. I'm the coordinator of the Master's Nursing Program at Texas Women's University Dallas Center. And it's not a question, it's a comment. I just want to say how excited we are in Texas, and hopefully nurses all over the country are, that we have our own Senator Eddie Bernice Johnson as one of the new kids on block in Washington, and I'm sure she must be feeling a lot of personal responsibility right now.
Thank you very much. Your response?
Well, it's really nice to have our first nurse in Congress, but one is not enough.
That's right.
And I hope that all of you out there will consider running. We need you to run in '94, and the ANA PAC would like to support you.
Absolutely.
Okay. One more question.
Stand up for a second. There's been no mention from the ADN folks, and there's the educators. My name's Deborah Antiotung, and I'm at VA, again, a clinical specialist, and one of the questions I have is there's a push toward BSN prepared nurses, and I support that, but what will happen to the ADN educators or the schools?
We've just gotten the wrap. I'm sorry we're out of time, but we can talk after we conclude today. I want to thank you, and thank you, Deborah. That is all the time we have for this very important topic. We'd like to thank Virginia Trotter-Betts and Gwen Johnson for being with us today, and also to our audience who took time out of their very busy schedules to be here. Now, today's program was designed for nurses, about nurses, and we hope you have a clear understanding of what can be expected from healthcare reform in the future. I'm Vicki Hudson, and thanks for joining us.